Congress cannot sit by and watch as Americans' rights and liberties are stolen from them. On November 6th, the Fifth Circuit temporarily halted the OSHA vaccine, and on Friday, the Fifth Circuit reaffirmed its stay of the mandate. Despite these court rulings, the Biden administration continues to impose its vaccine mandates. White House Deputy Press Secretary Karine Jean-Pierre told reporters during a briefing, quote, "They, businesses, should continue to move forward and make sure they're getting their workplace vaccinated," close quote. As President Biden continues to move forward with his unconstitutional, un-American, and unscientific vaccine mandate, the House Freedom Caucus will remain committed to standing up for the rights of all Americans and to defend their right to make their own medical decisions. We have great witnesses who are here. I'm looking forward to hearing from them, and we're going to have interchange with questions and answers. And we're going to now hear from our witnesses. First, we'll hear from Elaine Parker, who's president of the Job Creators Network Foundation. She will provide insight into the small businesses who have filed a lawsuit against the Biden administration to block its recently finalized employer vaccine mandate. We'll have Dr. Molly Rutherford, a medical expert who has practiced medicine in rural and semi-rural Kentucky since 2006, and prior to medical school had earned a master's in public health with an epidemiology focus at Hopkins. James Crocker, president of Hog Technologies. He's a business owner who will be affected by Biden's vaccine mandates. Jonathan Berry, partner at Boyd & Gray & Associates, who was head of regulations at labor under the Trump administration. He is working as a partner with Boyd & Gray and has filed a lawsuit on behalf of Job Creators Network and many small businesses in the U.S. Court of Appeals in the U.S. Court in the Eighth Circuit. Sean Thema, am I close? Sean Thema is Chief of Staff at Young Americans for Liberty, and he'll discuss how the vaccine mandate has affected students on our college campuses. Each one will give an opening statement lasting no longer than 5 minutes. We'll start waving our arms when you're getting close, so you'll know. And then after that, we will go to questions by members of our committee. With that, we'll start with Ms. Parker.
Thank you, Congressman Biggs, and thank you to the House Freedom Caucus and also Freedom for listening. So, thank you. Thanks so much. Hello, my name is Elaine Parker, and I'm the president of the Job Creators Network Foundation. The Job Creators Network is the leading national small business organization. Together with our small business members, we fight to maintain the American dream. JCN, along with several of our small business members, have filed a lawsuit against the Biden administration to block its recently finalized employer vaccine mandate that will have a significant impact on America's small business community and the tens of millions of people they employ. This new OSHA rule forces employers with 100 or more workers to require they get vaccinated or get tested weekly and wear masks. This is illegal government overreach at its worst. Affected businesses will be on the hook to cover paid time off for workers to receive the vaccine or get tested weekly. Businesses that don't comply can be fined up to $14,000 per violation or up to $140,000 for repeated violations. Never before has the federal government mandated vaccines for so many Americans, let alone at the order of the president, without clear support from Congress. OSHA does not have the authority to enact such a sweeping health mandate. Even if it did, there's neither the grave nor immediate conditions required for such an emergency regulation. COVID cases are decreasing, new therapeutics have been developed, and we are approaching herd immunity. This mandate is not a small ask of America's employers. Businesses are just recovering from the pandemic. They are dealing with the highest inflation we've seen in 30 years. They are struggling to deal with a supply chain crisis, and most of them cannot find enough workers. Does this sound like a good time to deputize them as health police? The rule would exacerbate what's already the worst labor shortage in recorded U.S. history by requiring employers to terminate some existing staff who do not wish to get vaccinated or get weekly tests. It will also shrink the pool of job applicants available for hiring. Associated staffing shortages would force businesses to reduce capacity and economic output, causing financial harm to businesses and employees and the communities in which they are located. Several JCN members have joined our lawsuit, including James Crocker, founder and president of Hog Technologies in Florida, who will be speaking here today. Other co-plaintiffs include Eric Lawrence, CEO of Lawrence Transportation Company in Minnesota, Guy Berkebile, president of Guy Chemical in Pennsylvania, and his employee, Terry Mitchell. Gary Rabine, founder of the Rabine Group in Illinois, Nicholas Pyle, president of the Independent Bakers Association, and Howard R. Alton III, president and CEO of Panagold Baking Company in Minnesota. These small business job creators would all be significantly harmed if the Biden administration's illegal mandate takes effect. Last Wednesday, the Eighth Circuit Court granted JCN's request for the government that the government expeditiously respond to our stay motion. The judge ruled that the government must reply by last Friday afternoon, which they did. JCN then filed a response arguing the government's claims are without merit and reiterating our request for expeditious review. This lightning-fast action by the court signals it is open to granting an injunction striking down this illegal mandate. The Biden administration actually called on employers to continue implementing their vaccine mandates despite a temporary stay issued by a federal court. This action indicates that the administration smells defeat in this case and is trying to get as many businesses as possible to comply before the mandate is struck down. Let me be clear. Our objection to this mandate is in no way an anti-vaccination position. We understand that vaccines save lives, but we also understand that small businesses have enough on their plate right now. They should not be forced to act as vaccine police to their employees. We believe the Biden mandate is a massive government overreach and are asking courts to strike it down before it wreaks havoc on America's businesses and the economy. Thank you.
And thank you, Ms. Parker. Appreciate that. Appearing by Zoom is Dr. Molly Rutherford. Dr. Rutherford, we'll give you your 5 minutes for your opening statement.
Thank you. Thanks for the opportunity to speak to you today. My name is Dr. Molly Rutherford. I'm a family physician and an addiction specialist, and I'm a small business owner. I've been practicing in rural Kentucky since 2006. I did earn a master's in public health at Johns Hopkins prior to med school and was working at NIEID at the time. From 96 to 99, I worked down the hall from Dr. Fauci, where I prepared his quarterly remarks to council, briefed him for hearings on Capitol Hill, and wrote a short pamphlet on vaccines, focusing on how childhood vaccines saved many young lives. My experiences provide a unique perspective on the many unprecedented policies over the past 20 months, including vaccine mandates. As an independent doctor, I'm accountable to my patients, not a hospital administrator or a government bureaucrat. Many of my colleagues are self-censoring and staying quiet about the pandemic due to pushback by the institutions that employ them and the current divisive culture in medicine, where reputable positions are being maligned and censored. I'm willing to risk my reputation in order to speak the truth, and I have no financial or political motivation for expressing my opinions. I will readily admit when my opinions turn out to be wrong. In March 2020, when 15 days to flatten the curve began, I was confused and worried. I knew that the measures being implemented were unprecedented, so I assumed that the deaths and hospitalizations were going to be devastating. And they were in many places, including New York City. However, as cases and deaths remained quite low in Kentucky and hospitals began to struggle financially, I started to analyze the data myself. In March and early April, I appeared on a news station in Louisville as a local expert to answer questions about COVID, focusing on symptoms and how to protect oneself. In March of 2020, at the end of March, a patient's son died of an overdose when his court date was canceled and probation and parole stopped seeing people in person. This mom had to break the news to her mom, the boy's grandmother, through a door at a nursing home because she was not allowed to enter. Meanwhile, my husband, a homicide detective, was working a record number of shootings, overdoses, suicides, and homicides in Louisville. I asked the local station if during my segment we could talk about the secondary consequences of the lockdown policies, and they declined. This was April 2020. I knew then that the lockdowns would have devastating long-term consequences, especially for kids and people who were unable to stay home. By May 2020, we knew from data in other countries that children were not getting sick with COVID or transmitting it. Yet our public health experts declared that peaceful protests were safe and schools and churches were not. My husband was called to work a peaceful protest at the end of May in Louisville and worked them all summer and into September when 2 police officers were shot at a protest. In 2020, I met Dr. McCullough and some other doctors treating COVID on the front lines. He helped me treat my brother, and I started treating COVID shortly thereafter in my office and by telemedicine. In November of 2020, my staff and I got COVID. 1 year later, I tested positive for SARS-CoV-2 nucleocapsid antibodies. I am unvaccinated because I don't need the vaccine. After approximately 30 exposures to COVID over the summer, no one in my office developed a reinfection. I am not anti-vaccine. I'm fully vaccinated against all recommended adult vaccines, and my kids are fully vaccinated. When the vaccines were developed, I was optimistic. I scheduled my parents, age 87 and age 79, for the vaccine, and they completed the Moderna series in February of 2021. I recommended it to people who were high risk. It was difficult to give informed consent because the vaccine insert, which is the paper that the pharmaceutical company provides with adverse reactions, etc., was blank. I had to rely on the short trials when I spoke about efficacy and then what I was hearing from other doctors about safety. The vaccines were and still are experimental technology. I've diagnosed several breakthrough infections in vaccinated patients in my small practice. While none of my patients have been severely injured from the vaccine, side effects and symptoms from this vaccine are much more severe than anything I've witnessed with other vaccines. I want to add that I moved to Kentucky during the opioid epidemic, and I've treated addiction for 13 years. I'm skeptical of government and pharmaceutical companies because of this experience. The FDA and Purdue Pharma colluded to label OxyContin as non-addictive opioid and sold it to people in Appalachia. Over 800,000 people have died of overdose since 1999. Not surprisingly, overdose deaths increased in 2020 after a promising decline in the previous 2 years. 3 of my former patients, all in their 20s, died of overdose last year. Here's what we know about COVID and the vaccine. These are facts. Severe COVID and hospitalization and death from COVID have
30 seconds, doctor.
Okay. Vitamin D deficiency being one. Children at almost zero risk of death from COVID. Vaccine effectiveness wanes faster in the elderly people. It's waning very quickly. And the basis for the mandate is that COVID is a grave danger to employees. The argument makes no sense because vaccinated people are just as likely to carry the virus and spread it. My vaccinated colleague who's never had COVID is free to travel to New York City and attend a Broadway show and dine at a restaurant, while many healthcare workers and other frontline workers are being discriminated against. It's a violation of medical ethics. Do you need me to stop?
Yes, I want to keep hearing you, and hopefully we can get more information as we go, but you've exceeded the 5 minutes, Dr. Rutherford. Thank you.
Sorry about that.
No, that's okay. Your information is really valuable, and we really appreciate it. And now we'll hear from Mr. James Crocker, President of Hog Technologies. Mr. Crocker.
I am so loath to read. I rarely do so, but I suppose in this environment I should. So, my name is James Crocker. I'm a devoted husband, father of 5, entrepreneur, inventor, author, and God-fearing American. In 1988, God told me he was going to bless me to give through me, not to me. He never even had me in mind. I started with a small pressure washer I bought for $1,200, and today, 32 years later, we're the undisputed world's leading manufacturer of runway rubber removal systems. We invest millions each year in creating new innovations and new jobs, and thus we now have a greatly expanded product lineup, including roadway, runway, marking vehicles that include paint trucks, thermoplastic extrusion trucks, plural component trucks, other innovations. Today our vehicles are in 56 countries around the globe. I'm skipping a bunch of stuff, Andy. I don't want to get in trouble with you, sir.
You're all right.
Roughly 35% of our goods are exported to other countries. We maintain facilities Stuart, Florida, West Palm, Czech Republic, and Dubai. We employ 194 people here in our U.S. operations. I'm here today to address my views on the vaccine mandate the government seems intent on burdening me with. No thoughtful discussion of this mandate can happen without discussing the environment that currently exists in the country. Inflation's at a 30-year high. The price of gas, up 60%. The price we pay for steel, up 400%. The price you pay from shipping a container from Europe to U.S., from China to U.S., up 400%. The price of a used car, up $5,000 year over year. The price of a house, up $80,000 year over year. The price for hydraulics, electronics, plumbing products, they're all out of control. And I'm going a little off script here. We need 5 financial analysts just to keep up with the price increases and try to pass a portion of that on to our consumer. If we passed it all on to our consumer, we believe it would shut down our orders almost immediately. The price increases would be bad enough if you could actually buy the products themselves. I brought with me a simple little switch here. Been buying this switch for 15 years. It turns something on or off. Normal lead time, 2 weeks. These have been on order since June. Can't get them. We're now buying that part from multiple vendors and assembling that switch at hog quarters in Stuart, Florida. Consider this, 2,200 parts required to make our most common water blasting truck. Our purchasing staff has doubled. Cost increases, I can't even tell you what they are because, again, it would take a whole team of experts to track it all. But all of these snarls makes planning our jobs virtually impossible. Last month, our earnings on revenue was half of what it should have been, just because of all the inefficiencies associated with these supply chain shortages. Beyond inflation and supply chain, but directly related to them, is cash. Cash is king. If you run out of cash, you don't have a business. If you fail to manage all of your bank covenants properly, and the bank calls your note, you're out of business. Lastly, I'd like to address workforce issues. You know what it's like. There are worker shortages. All of us are fighting over the reduced work pool created by all of the enhancements to the normal unemployment. And all the people who are just tired of the mask mandates and all the mandates that all of the government intrusion into our workforce, those that could afford to just retire early have done it. When we lose team members, we lose our investment in them. We could pontificate for hours as to why there are fewer people in the workforce, but the undeniable reality is there are.
30 seconds.
And thus it is in this environment that the government wishes to address a broke leg instead of a gushing artery in the neck. You know, if you're going to triage a patient, you better get your priorities right. And there are just millions of small business people around the country who know and understand that the biggest challenges facing us are not people getting COVID. We haven't had a person get COVID now in probably 6 weeks. The biggest issues are inflation, supply chain issue, shortage of workers, and yet we hear nothing about the government addressing these very important issues. And I think we should reprioritize before it's too late.
Thank you, James. Appreciate that.
I did shut down another top line.
We've got now Mr. Berry for 5 minutes.
Thank you, Congressman, and thank you to the House Freedom Caucus for having me. My name is Jonathan Berry, and I'm a partner at Boyd & Gray & Associates, a law firm founded by Ambassador Gray to fight federal administrative overreach in furtherance of his legacy doing just that. I previously served as head of regulations at the U.S. Department of Labor under President Donald J. Trump, as an attorney advising on judicial nominations and regulatory policy at the U.S. Department of Justice, and as a law clerk to Associate Justice Samuel A. Alito, Jr. of the Supreme Court of the United States. I am honored to speak with you today as an attorney for my client, the Job Creators Network, and the Coalition of Small Businesses it leads, including Hog Technologies, whose president, Mr. Crocker, just spoke with you. I'm here to tell you why this OSHA vaccine mandate is illegal and why we have sued to shut it down. Now, I'm not a stranger to OSHA. That agency, which is part of the Department of Labor, does important work to ensure worker safety across a variety of areas, from hard hat requirements to asbestos controls. And as head of labor regulations from 2018 into 2020, I was proud to work with OSHA on a variety of rulemaking initiatives to protect workers. For example, OSHA requires employers to keep detailed records of workplace injuries and illnesses. But we amended OSHA's reporting regulations so that employers were not transmitting detailed records about individual employees' medical and personal information to the federal government. As part of our obligation to protect workers, we strived under President Trump to protect workers' medical privacy against unnecessary federal intrusion. How things have changed. Now, OSHA has issued this sweeping new mandate requiring that businesses across the country subject their employees to vaccination or regular testing and masking. Along with the CDC and eviction moratorium, this is perhaps the most breathtaking assertion of regulatory power we have seen in the wake of COVID. And like the CDC's edict, this OSHA mandate is flatly illegal. It crashes directly into the Supreme Court's warning that, quote, it is unreasonable to assume that Congress intended to give the Secretary of Labor the unprecedented power over American industry that would result from upholding a mandate this broad. Again, this is the court saying, when you think OSHA, think hard hats and asbestos, not mandatory injections under the pain of losing your job. Here's the court again, quote, when an agency claims to discover in a long extant statute an unheralded power to regulate a significant portion of the American economy, we typically greet its announcement with a measure of skepticism, unquote. That was against the EPA, but it applies equally here in the OSHA context. Even more audaciously, OSHA put out this mandate on an emergency basis, nearly 2 years after the horse left the barn, in order to bypass the ordinary democratic safeguards on overregulation, namely public notice and an opportunity for ordinary Americans, particularly the small businesses hardest hit by this mandate, to file their objections. But this needless emergency route also puts the mandate under a further cloud of uncertainty. Courts have been quite hostile to OSHA's prior invocations of emergency power. Before this year, OSHA had issued fewer than 10 emergency standards, all much narrower, by the way. But of the 6 that were then challenged in court, 5 were fully or partially vacated or stayed. That is a terrible batting average. Part of what OSHA must do to justify this emergency mandate is show that it was necessary to combat a grave danger. But OSHA has failed to act until the Biden administration apparently calculated that the time was ripe. And it's common knowledge that the COVID pandemic has been ongoing since early last year, and vaccines have been widely available for almost all of 2021. OSHA has given no persuasive justification for why there is suddenly such an emergency now, November of 2021, when nearly every single state is easing its COVID restrictions, and so many Americans have already gotten vaccinated. For these reasons, we have filed suit on behalf of Job Creators Network and Hog Technologies and many other small businesses in the U.S. Court of Appeals for the Eighth Circuit, where we have asked the court to halt this illegal employer vaccine mandate immediately. Thank you very much.
Thank you. And now we'll go to Sean Tamia, Chief of Staff at Young Americans for Liberty. Sean.
Thank you, Congresswoman Green, Congresswoman Miller, Congressman Moore, Gomert, Good, Davidson, Biggs, Heiss, and Bishop. Thank you all for joining us here today. My name is Sean Tima, Chief of Staff at Young Americans for Liberty. We work with college students and state legislators to make millions of people more free across the country. And for what it's worth, I'm a recovering progressive, so it goes to show the kids aren't too far gone. You all understand how dire the situation in higher education is today. You all know that we desperately need to stand up for these students or no one else will. You know, the enemies of liberty have known this for a long time. They know that being a college student is one of the most transformative times of a young person's life. That's why they've worked, to subvert this institution for so many years, an institute of woke, dystopian, anti-constitution culture, which is truly coming to a head in light of the precedent set by the Biden administration with these forced vaccinations. In the majority of these schools, when you think about it, thanks to federal student loan programs, they're funded by you and I and everyone in this room. And that makes it that much more egregious when they bend the confines of power to lean on students and enforce these forced vaccinations. They've just taken such an advantage of it during the Biden administration. You know, with the rise of COVID, college students, even though they're in a low-risk group, they're being subjected to some of the most unfair COVID restrictions and COVID mandates compared to any other American in the country. Limited but not including to a widespread implementation of mask and vaccine mandates, student surveillance by mandatory smartphone apps, vaccine-based segregation policies on campus, and sometimes even mandatory classes shaming students for their own personal medical decisions. Here are a few examples reported to us by Young Americans for Liberty students. This year at Oakland University in Michigan, a student was kicked out of her dorm, charged with conspiracy to violate university policy, forced to move off campus and take online classes after she posted about her religious exemption on Facebook. At Ithaca College in upstate New York, my alma mater, unvaccinated students need to show a negative COVID test to enter class, but the administration can't always process these tests in time, so how are the students supposed to go to class? Other schools, like the University of Nebraska-Lincoln, force students to download smartphone apps that use Bluetooth for contact tracing. If they fail to comply with weekly testing or break COVID regulations, administrators can use these apps to deny students access to all academic buildings. And at the University of Colorado Boulder, students who have been given exemptions from the vaccine are forced to take a mandatory course on, quote unquote, the benefits of vaccines and importance of them. So if they don't take the class or refuse to meet the teacher's standards for this class for their own medical decision, then they could have a permanent fail on their academic record. And finally, at Rutgers University, a student at the beginning of the year, his senior year, was disenrolled from attending classes because he did not take the vaccine. Important detail, though, he was 70 miles away from the campus. He had chosen to attend as a virtual student that year, and he was still forbidden from going to class. It's insane. Now, these students exercising their medical freedom, they're being alienated, taunted, even harassed by some of their faculties and peers. Some are having to choose between their convictions and their education. The college administrators are saying they're doing this for the public health, but at what cost to students' mental health? And like many government actions, we may not understand the full consequences, the full collateral damage of this vaccine mandate and COVID mandate precedent until it's far too late. Now, Young Americans for Liberty is fighting back. We're organizing students and training them on how to combat, put grassroots pressure, rally students, gather petitions, and challenge directly the vaccine mandates on their campus. And those administrators know we're not going away and all legal options are on the table. But we need more, and I love to hear about this litigation. I love to hear that we're challenging and bringing forth NOSHA. If I could ask one thing of this committee that could help college students, the question that I hear all the time is, what will it take for this to end? And it made me realize, just like the war in Afghanistan, no one has ever defined success in what the war on COVID looks like. And so we need to ask that question. By what standard will these mandates end, and demand that of our leaders in D.C.? Thank you for your time.
Thank you, Sean. Now, I'm going to yield time to the gentleman from Ohio, Mr. Davidson.
All right. It's not fully outfitted as a regular committee room, but we're making do pretty well. So thank you all for the travel, the preparation, and frankly, the commitment to address really a civil liberties issue. I mean, the idea that the federal government could do what we've seen done, and frankly, in an unchallenged way, executives from around the country, we saw governors, people paid a lot of attention to who their governor was this past year, go unchecked by most legislatures. A handful of legislatures were in a position to challenge the abuse of executive authority by their governors. But really, we have a republic, if we can keep it. And I think that's really what's at stake here. Can we actually keep the form of government that our Constitution established? We're seeing it abused, and I just want to highlight, the idea that the mandate would compel, James, whether it's your business or doctor, if it's your medical practice, if under the CMS mandate, if you want to get paid for Medicare or Medicaid, you have to conform. If you're a defense contractor, you have to conform. It's literally you submit to the authority of the government in a private sector way. And I just want to reference a case from 1973, Norwood versus Harrison. It says in the ruling that the government may not induce, encourage, or promote private persons what it is constitutionally forbidden to accomplish. I mean, fundamentally, I think that's an application here. I'm not a lawyer. I'm not a law school. I'm just looking for how can the government do this in its way. So, Mr. Berry, I don't want you to tip the hand on the cases that were out here, but you highlighted not just the problem with the OSHA mandate, but I think just broadly. When we looked at the Affordable Care Act, the Supreme Court ruled that even with a congressionally passed bill, normal process of law, Congress and the President do not have the authority constitutionally to mandate that someone buys health insurance. How in the world could the federal government mandate that you have a medical procedure or that your employer becomes the police force in the absence of the government to do that? Could you highlight the constitutional issues with that?
Happy to, Congressman. Absolutely. Yeah, we're seeing. There have been some very strong challenges filed alongside our own, as well as ours, raising these really profound questions of constitutional law that you've mentioned. So, for example, we have challengers who are arguing that this exercise of authority under OSHA is a violation of the Commerce Clause, for example, and in line with the ruling from the Supreme Court in the Obamacare case in NFIB v. Sebelius that it is it's not permissible to force, in that case, health insurance purchases as an exercise of the commerce power. We've likewise argued that Congress can't give its power over the executive branch in sort of a blank check, kind of a delegation, a legislative power. Some of us still subscribe to the Schoolhouse Rock vision of the separation of powers, where it's your role as the legislative branch to write the laws, and the executive branch merely enforces those laws. But these days, a lot of that seems to be getting displaced by executive order.
Yeah, thanks, and by the courts as well. So, look, as is often the case, it's not whether or not it's a good idea to do something, it's whether or not the federal government has the authority to be the doer of the thing. And I think here the challenge is twofold. One, the federal government doesn't have the constitutional authority to do this. Two, the means that they're using are even more flawed than the actual Constitution. And then lastly, when you think about the science, Doctor, you highlighted some of the flaws with science related to this particular vaccine and also the dearth of data on natural immunity. Countries around the world are recognizing natural immunity. Isn't it odd that none of these mandates recognize that in the United States? And why do you believe that would be in this particular case when normally that's something that's part of science?
Doctor, I think you're muted still, perhaps. We're trying to unmute you over here.
So
we're just
I think you-
there we go.
I think you have to do it. You got me?
We got you loud and clear now. Yes.
Okay. So we actually have about 122, probably more than that, studies now affirming natural immunity. And the problem is we're still relying on the CDC for all of those recommendations. The only government, there are a few governors who are not relying on the CDC's recommendations. They have been reluctant for some reason to keep track of any data on natural immunity. I can tell you, I've diagnosed probably 30 to 40 breakthrough cases of COVID and 0 cases of reinfection. So, and my practice is pretty small, and I'm hearing this from other doctors.
Doctor, I
it's not
appreciate
we
that.
Don't have this.
I appreciate that, and you got it in. I got to you late, and we don't have our normal view of the shot clock here. So in respect to the other folks, we'll probably cover some of the same things. But thank you for just acknowledging what we know in the room, and frankly what CDC and NIH know is natural immunity works. And that's not to take anything away from the claim on vaccines. It's just something that isn't being acknowledged. My time has fully expired, and I yield.
Thank you. Gentleman recognized. The gentleman from Texas, Mr. Gomer.
Thank you, and thank you all for being here. Dr. Rutherford, when you're considering prescribing something, whether it's a shot or it's oral medication for a patient, do you cover with the patient the potential risks inherent to that procedure, drug, whatever?
Yes, absolutely. That's one of the principles of medicine. We provide informed consent. So when I prescribe, what's really funny is I actually do prescribe hydroxychloroquine and ivermectin for COVID, and I took hydroxychloroquine myself. So when those medications were being demonized for being off-label, it was confusing to me because prescribing off-label is something that doctors have done forever. I prescribe much more dangerous medications off-label on a daily basis for alcohol withdrawal and for addiction. So I'm not really sure what is happening. There seems to be a coordinated effort to discount early outpatient treatment and to try to get more people to get this vaccine. And the
Well, that
thing is,
seems to be,
don't need it.
That seems to be the bottom line. It's all about getting people to get the vaccine, and it's making a lot of money for some folks, but we're not getting the warnings that people should give. In fact, but the President Biden says we have got to protect the vaccinated from the unvaccinated, and then he goes on to explain because we've got to get the unvaccinated the vaccination that does not protect you from unvaccinated, which is a little hard for some of us to fully appreciate. But I had a pharmacist that gave me the warnings for the Johnson & Johnson, and I'm sure it's about the same for the other two. And these are the warning labels. It comes, and it says COVID-19 vaccine, and it says for use under emergency use authorization. So here is all of the warnings. In other words, there are no warnings, and that's because of those words I just read, for emergency use authorization only, which means they don't have to give you the warnings. And I just heard from a friend here in Washington recently, his wife's first cousin in West Virginia, her husband decided to get the vaccination. He did, and they were concerned because he had some comorbidity conditions. He got the vaccination. They know because of all the work before the vaccination, he had no blood clots. And immediately after the vaccination, he immediately got blood clots and died before anything could really be done. So his doctor, being an honest doctor, said cause of death, vaccination. But he was told by the health officer that if he didn't remove the word vaccination from the death certificate, it would never be certified. Well, you got to have a certified death certificate, or you can't move forward with your life and change the name assets are in. Have you heard of anything like that happening where people are refusing to give vaccinations credit for damage that they've done?
I have heard that, and then we know actually of 18,000 deaths that have been reported in the VAERS system that are thought to be due to the vaccination. However, there does seem to be a coordinated effort to downplay those deaths. And any doctor who treats patients has seen some other bad side effects from these vaccines, more than any other vaccines I've given.
Well, we've heard from Dr. Fauci now just recently that turns out the vaccinations aren't nearly as effective as they thought. So, gee, everybody's got to have a booster. We don't know if it means everybody's going to have boosters quicker and quicker. But my point is, if Dr. Fauci will be that wrong, maybe he's lying, maybe he didn't know he was lying, but if he will be that wrong about something that important, then it seems like he should not be given the credibility to decide everybody's health care treatment to wit vaccination for them. And I see my time's expired, but thank y'all all for being here.
Thank you. Just 2 quick points for those of us up here. Melissa is going to just look over here. She's got the timer going, so you can see.
Oh, there.
Yeah, we're more used to a timer, folks. That's what's going on. And then the second thing is, there's a mechanism I will employ to attempt to get much of what we do here today included in the congressional record. So if you have documents or whatever that you want to get into the congressional record, let me know, and I'm going to try to.
I'm asking them consent to include a copy of the lack of warnings on the warning.
Without objection. And with that, I recognize the gentleman from Maryland, Dr. Andy Harris.
Thank you very much, and thank you all for being here today. Let me just ask you one question, Mr. Berry, because you mentioned hard hats. OSHA doesn't require hard hats everywhere a worker works in a company less than more than 100 people, does it?
I don't think so, no.
You don't think so, right? And they don't require, and they call it hard hats, not soft hats, so they require something that really does prevent the damage, right?
Absolutely.
That's what I thought, because we're this being compared to hard hats, and this is nothing like hard hats. This. Now, Dr. Rutherford, I'm going to ask you a question because you're in a primary care setting, and you brought up off-label prescribing. It's interesting because actually an action is currently being attempted against my medical license for prescribing ivermectin, which I find fascinating because as an anesthesiologist, I know I use a lot of drugs off-label that are much more dangerous, but there's one drug we use, and I don't know if you're familiar with it, ketamine, which has been used to treat depression since 2014, is still not FDA approved because it's generic. It's cheap. But the FDA did approve the more expensive S-ketamine, and that's actually what you'd have to give if you want to give an FDA-labeled drug. So what I'm going to get to partially is the idea of treatment versus vaccination, because it's becoming increasingly clear that medicines like fluvoxamine, which had an impressive greater than 2/3 reduction in serious illness and death, I think ivermectin, there are other ones that are coming down the line. Is this where we should be looking, instead of mandating vaccines, the way this pandemic is going, it looks like what we're just going to need are very good treatments, because when the next variant comes around, this vaccine may be of no use against it. What's your feeling on the importance of emphasizing treatments versus vaccines? And hold on, we've got to unmute you.
Sorry, doctor, we need to unmute you.
Okay, now
You're on now, yes.
Okay, so I've treated hundreds of people with early outpatient treatment, and including the medicines that you mentioned, and then also with monoclonal antibody infusions. In fact, even vaccinated people that I was really worried about, I sent for monoclonal antibody treatments, and they're very effective. So I would like to see early outpatient treatment get more attention. The issue with the vaccines is they're not doing what we originally hoped they would do. They do not stop spread. People still get the virus, and so mandating it doesn't make sense. For example, my son caught COVID from a vaccinated child, and he is unvaccinated. But yet what we're seeing in the schools and in workplaces is people that haven't had the vaccine are being discriminated against, basically. Kids are being isolated. It's really terrible.
Sure. Let me just bring that up a little bit, because the latest CDC, shall we say, experimentation is by approving the vaccine as safe and effective for 5 to 11-year-olds, when they know full well the FDA advisory committee, many people on that committee said they we're torn because if they didn't declare it safe and effective, it couldn't be used in high-risk children, and yet CDC made it safe and effective in all children. And then we have, of course, San Francisco famously doing a mandate for that, for children, 5 to 11-year-olds. Could you just comment on the next wave, which I think is going to be a push from the federal government to actually mandate vaccinations of an EUA? This is clearly under EUA. Only 3,000 children in a 3-month trial, and yet they're claiming long-term safety. Could you comment on vaccine mandates in 5 to 11-year-olds?
There's absolutely no reason to vaccinate 5 to 11-year-olds. There's no reason to vaccinate children for COVID. They are not at risk. There's something that we consider in public health called the absolute risk. So even if, and I don't think this has been demonstrated, but even if the vaccine were to reduce the risk of death or hospitalization by half, if the absolute risk is very, very tiny, and then we have there's 1 out of 6,000 cases of myocarditis in kids from the vaccine, then very clearly the risk of the vaccine outweighs any potential benefit from the vaccine. So I'm worried that they're going to try to do that as well. And I'm thinking of that'll be my line in the sand where I take my kids out of public school.
Sure.
But it really doesn't make any sense, and it's going to harm kids.
And Mr. Berry, just one last question as my time runs out. Is there any situation where any vaccination has been mandated by the federal government for an adult, or even a state, where they mandate broadly? I mean, look, I know because, and Sean, you may realize this, if you go to some colleges, you need the meningitis vaccine if you want to live in a dorm. I get it. But we're not saying all people. We're carefully targeting that. Is this completely unprecedented?
Gentleman's time's expired. We're going to let you answer the question, Mr. Berry.
Thank you very much.
I don't know what I mean.
I can't claim to have done a comprehensive canvass. This is extremely unusual, and even the most famous case of vaccine mandates, Jacobson v. Massachusetts, was candidly a much lower stakes case. Inflation adjusted today, $150 fine, not losing your job.
Thank you. And now I recognize the gentlelady from Georgia, Ms. Green.
Thank you. I appreciate it. Is it on? Well, first I want to thank each of you for coming today, taking time out of your busy life and at your own expense. We greatly appreciate it and feel this is very important. As a new member of Congress this year, Mr. Crocker, I relate very much to you. I own a small business, also a commercial construction company. I'm very familiar with OSHA. And so one of the first bills I wanted to work on was working against vaccine mandates. As a matter of fact, I consider them discrimination in the workplace. And it's also communism, absolute communism, that we would see the Biden administration force federal policy, force regulations through employers that violate their medical freedoms and put their lives at risk, such as the good doctor's been talking about. This is such a risk for people's health. They should be able to choose, and the vaccine really has such a low risk of death, hospitalization and death. As a matter of fact, obesity and the older age groups are the ones that are at most risk. Also, it's interesting that 46,993,724 cases of COVID to date in the United States, and tragically we've had 760,266 deaths. No one wants anyone to die, but it's clearly based on these numbers that it's a very low risk of dying over the past year and a half that we've been affected by the CCP bioweapon COVID-19. Now here's my question, Mr. Crocker, how many employees do you have roughly?
194 team members.
Okay, so with 194 team members in the United States, if say approximately 20 to 30% of your employees were to say we're not going to get vaccinated, and then you're forced to pay fines to the federal government, you're looking at millions and millions of dollars of potential fines, possibly per year. And I would imagine, how would that be for your business?
On top of the current challenges, it would be absolutely devastating.
It would be devastating. And then, Mr. Crocker, you're involved with the lawsuit with Mr. Berry. And Ms. Parker, you're representing a lot of small businesses that are involved in lawsuits. I also know that legal fees are not cheap, and this is a big expense that business owners are taking on by suing against these unconstitutional vaccine mandates. How much money are we looking at on average per small business owner that's going to have to pay for legal fees?
I don't think I can, if that's directed towards me, I don't think I can contemplate that. I don't think we really know what the eventual cost will be. But it's a big distraction, and it's a big distraction that we can't afford at the moment. You know, the government used to be about information, not dictation. We used to teach people how to think. We didn't teach people what to think. And I just think it's, it used to be about education, not indoctrination. And all of this is just completely the wrong way to go about things.
And then as a business owner, you are already working very long hours, taking great risk as a business owner, doing a good job taking care of your employees and serving your customers. It is absolutely tyrannical and authoritarian for our federal government to make your life this much more difficult for you just to operate a business and try to make a living.
One of the things that makes it particularly difficult is we have a guy who used to skate for Disney on Ice. He's been with me for 15 years. He sold product. He's our star salesman. And he's the only guy I know that could do a standing backflip on a pair of ice skates, which might make it pretty easy for you to identify who this man is. He got the J&J vaccine. 10 days later, can barely walk. His feet and legs are numb up to about his knees. Numbness in his mouth, numbness in his hands and arms. He's been fighting this now for 4 months with very little progress. If I announce this mandate, particularly because this story is so well known in the company, we could easily lose 40 to 50 people. My VP of marketing has already told me, you do this. And Mr. Gomer, you know these people. We had dinner with them in Tampa at the Operation 300 event. And he said, if you do that, I definitely am the first one out of here.
Right. So now you have an employee that can no longer physically function very well due to an injury from this COVID-19 vaccine. The VAERS system is reporting over 18,000 deaths, just as the doctor mentioned. This is crushing for your business. It's crushing for these employees, and it's crushing the American people and our spirit and destroying our freedoms. I introduced a bill because it was so important to me called the We Will Not Comply Act back in early April. I want to tell you it's hard for us to get bills passed as Republicans right now in Congress, but this bill would completely eliminate all of the problems that you're facing as an employer and your employees are facing trying to do their job and make decisions and having the freedom to do so. So thank you very much for coming, and thank you for representing small businesses and students, and thank you, Doctor, for being willing to speak the truth.
Thank you. Now recognize the gentleman from Virginia, Mr. Good.
Thank you, Chairman Biggs, and thank you to our panelists, our witnesses. You help us do our job better. We're always trying to look for ways to get stronger in our messaging and to get more informed in what we say, and we're really grateful for your time and investment with us today. I have said a lot recently that there's not a greater or more pressing or more important issue facing the country right now. There's not another issue that literally affects the lives and livelihoods of tens of millions of Americans and tens of thousands of each of our respective districts. Nothing threatens the American people like this mandate that we see today. They're harmful. The mandate is harmful for many reasons, as we've already stated today. You know, our most basic, precious of freedoms are under assault and under threat and under attack from this administration. Things we couldn't even have imagined even just a year or two ago, our freedom of movement, our travel, our assembly, our worship, to open and operate our business, to go to work, to provide for our families, to worship, those kind of freedoms to be under attack and under assault so dangerously. And from a president who told us on the campaign trail a year ago, because he knew he wouldn't win if he was honest, that he wouldn't do this. And then he tells us just a few months back that it's illegal and he can't do it, doesn't have the authority to do it, and then does it anyway. You know, Mr. Berry, I think perhaps the most underappreciated aspect of the previous administration in terms of value was the decrease in regulations. So friendly to businesses, as Ms. Parker and Mr. Crocker know especially well. We wish we had you making those regulation decisions today. And we have this president who makes fun, he makes light of people's protests based on freedom. If anything encapsulates the difference between the left and the right, or those who love freedom and still believe in the Constitution, Mr. Berry, and old-fashioned that way, it's these mandates and this president who makes fun of, hey, I have my freedom to infect you with COVID, as he says that. This, as we said, these mandates provide no flexibility for those with health or religious concerns. I don't even like to say that, hey, we're pro-vaccine. We're pro-vaccine freedom. Thank God for the Trump vaccine, that people who want it and need it have been able to make that decision to protect themselves. And as Dr. Rutherford knows better than I ever could, on those who need it most, and they've gotten that protection. But we make no provision for natural immunity. I'm thankful for what she said about the children not being at risk. Mr. Crocker, you talked about your employees. We're making athletes get this. We're making children get this. We're making fans get this when there's no documented cases of those folks being affected from in those situations. And we're literally firing nurses and teachers and police officers and first responders, truck drivers. I had utility workers who were climbing utility poles by themselves come to me begging for help and relief because they're climbing a pole by themselves when they're being forced to get the vaccine or they're going to lose their job. Our president is not a king, and as my colleague to my left said, he cannot lawfully compel businesses to do that which he cannot lawfully do himself. I would ask Ms. Parker, what are you hearing from businesses? What are they saying? What are they going to do with the cost of this, with the risk of losing employees? How are they going to stay open and operate? What are they saying in response to this mandate upon them?
Thank you. Most of the businesses that I've spoken with or are part of the lawsuit are waiting to see what happens. So they're not enacting it within their companies right now. But some of the questions they've asked, the uncertainties have initially been costs. Well, they solved that because they're going to force the employees to pay for their own tests. So problem solved there, right? The other questions are liability. So who's responsible if an employee suffers an injury from this vaccine? Is it the government? Is it OSHA? Is it the employer? And then there's the fact that the employee is, their friends. That's their family. That's their work family. Somebody's being injured by being forced by their boss to get a vaccine. And most of the companies that we've spoken with have the same kind of story as James does, is that anywhere from 20 to 30% they feel will not take the vaccine or not do the weekly testing. Now, if you're a Delta or a Coca-Cola and you've got tens of thousands of employees and 30 or 40 people walk off the job because they don't want to comply, that's not a blip in your radar. And if you're fined $140,000 for multiple infractions, probably still not going to hit your budget very much. But if you're a small business owner with 194 employees and you have 40 people walk off the job, or 50 people walk off the job, or you're hit with $140,000 fines, that's a close the door kind of fine.
I know my time has expired. Thank you, Ms. Parker, but I would like Mr. Crocker, if the chair will allow, just a comment, and it ties to what Ms. Green said, but what would it take to put a business like yours under? What is the risk out of cash, out of business, out of employees, out of business too?
Let me pivot from that a little bit and just say that here I started with nothing but an idea and the drive and initiative. And what are we doing in America? We're changing the environment to where future generations are not going to be able to have that same opportunity. We're jacking with the soil in the pot that gave birth to so many businesses. And just one more thing. Nobody throughout this entire debate, you sit at home, you watch all the doctors, you watch all the lawyers pontificate, but nobody has drawn the very serious and undeniable relationship that exists between a country's economy and the health and safety of its people. If you go to Haiti, there's a reason why the life expectancy in Haiti is decades less than it is here in America. And so many other countries around the world. We have the longest life expectancy because we have prosperity, and we're killing our economy. In the meantime, all of these people are pontificating about this and that, and nobody's drawing the important relationship that exists between our economic prosperity, and right now we're jacking with the basic infrastructure that allows all of the trade and commerce to take place, and it could be too late for many, many businesses. Sorry about that.
Thank you, and members, remind you to try to do your best to stay at least within shouting distance of the 5 minutes. Appreciate that. And I recognize the gentlelady from Illinois, Ms. Miller.
Thank you. And I have two questions. The first one for Mr. Themia, and then the second one for Mr. Berry. So, you know, just we've all heard so many sad stories of how this mandate is affecting businesses and, you know, families, different things. But one that I want to share is our local university is strong-arming the students to get vaccinated. They tried incentivizing them, and now they're punishing them. So they're fining the students $150 a week if they don't get vaccinated. And for example, there's a Chinese student who had the virus and definitely did not want to take the vaccine. She actually had a doctor tell her not to get the vaccine, but she kept getting fined $150 a week. And she decided she could not afford it. And in fear and trepidation, she went and had that vaccine. She was in the emergency room and almost died that evening. There's going to be a lawsuit. So I have two questions for you, Mr. Themia. How widespread is this, that they're, you know, strong-arming students like this? And then Mr. Berry, is this, are they going to be able to sue the universities, or who are they going to go after?
Short answer. Test 1, 2, 3. Short answer is that the vast majority of universities, and I haven't seen a single university with a vaccine mandate that has also then dropped its mask mandate. Both stay, right? Which university in question was a student at?
Well, it's a university in my district in Illinois.
Okay. We can connect. I'd love to help get the student placed on a lawsuit, and we're working with some individual lawsuits as well, like UC Riverside, trying to win school by school in the courts. But
Okay.
It's too widespread.
So I would say that that's something that lawsuit merits some really serious investigation and development. There are sometimes or some circumstances where my understanding is that sometimes pharmaceutical companies may have immunity, for example, from litigation arising from vaccines that have had certain levels of approval, which really puts pressure on the whole approval process and the like. But that's something that merits, I think, very serious attention.
Thank you. And I yield back.
Thank you. Now recognize the gentleman from North Carolina, Mr. Bishop.
Thank you, Mr. Chairman, and I appreciate the witnesses being here today. Mr. Berry, you spoke a bit about the Fifth Circuit's decision in its, I guess, preliminary injunction or temporary stay of the OSHA mandate that the President has issued. You mentioned that you have litigation, I think you're participating in the Eighth Circuit. Is that what you said?
Yes, sir, that's right. Eighth Circuit.
And I assume there's litigation probably ongoing in every circuit court. Is that right?
To my knowledge, every circuit except the 10th Circuit Court of Appeals.
You know, we've become accustomed to questions like this getting resolved by litigation, but it almost leaves aside, if indeed it plays out the way the Fifth Circuit has kind of indicated, that this is one of the most breathtaking abuses of presidential power in history. The Fifth Circuit, you know, had a number of different grounds for saying it was. They say they're judging whether there's a preliminary likelihood that the plaintiffs will succeed ultimately in the case, but they attacked it not only on the basis of whether OSHA, the OSHA law is broad enough to do this, but also, as was made reference to earlier, several constitutional grounds, right?
That's correct.
And they said, among other things, that president is attempting to use OSHA for the federal government to exercise a general police power. And that, as I understand it, the police power is reserved to the states, and the federal government has no such thing. Isn't that right?
That's 100% correct, Congressman.
And the Fifth Circuit, you made reference to the Jacobson case, which I think about a 1905 case from the Supreme Court, in which a state, as you said, had mandated a vaccine for smallpox. And I see lots of times in the media reporters saying, well, that this is well accepted and it's established that this can be forced. Well, the federal government can't rely on that because it doesn't have any general police power at all, does it?
No, it does not.
So President Biden, knowing all that, has attempted to use a power the federal government doesn't even have. And the other thing that I noticed the Fifth Circuit said is he's attempted to regulate I think it's a non-commercial inactivity. In other words, it's sort of like a right to be left alone. The federal government has the right to regulate commerce, business throughout the states, as I understand it, but it doesn't have the right to regulate non-economic inactivity, I believe is the phrase. Is that right?
Yes, that's right.
And that's something that was, again, its reference was made, was established in the Sebelius case about Obamacare, right?
Yes.
Okay, and so a majority of the Supreme Court has said that. And so the president stepped forward to roll over the constitutional rights to be left alone of people like Mr. Crocker, business owners, and employees of every employer that has 100 or more employees in the country. Isn't that right?
Yes, that's right.
So let me ask you to speak to this. When presidents abuse power in such an enormous way, isn't that what the power of impeachment left to the Congress is for? Is to correct that, to remove a president who acts against the people and utterly steamrolls their constitutional rights?
So that's ultimately well within the hands of Congress to consider any kind of remedy like that.
And in the case of President Biden, after the court preliminarily, the Fifth Circuit initially said, without an explanation, just a summary order staying the mandate, I understood the Biden administration told people they should comply with the order anyway. In the face of that, did you see a story to that effect?
Yes, I did, Congressman.
And isn't it also true that President Biden, knowing that the Supreme Court had opined by a majority against an eviction moratorium some months ago, in the face of that, went out and ordered a new eviction moratorium for another further extended period of time that the Supreme Court then had to slap down?
Exactly right.
So why is it that this president believes, to the extent you can speak to it, why does this president believe he can ignore the rule of law and the constitutional authority of the Supreme Court?
I don't understand it, Congressman. His own chief of staff seems to have endorsed the workaround theory, which the Fifth Circuit pointed out.
My time's expired. Thank you, Mr. Chairman.
Thank you. And now recognize the gentleman from Georgia, Mr. Heiss.
Thank you, Mr. Chairman, and thank each of you for being here. And Dr. Rutherford, thank you for joining us on Zoom as well. I think everyone in this room acknowledges the fact that vaccine mandates are wrong. But when you go beyond that and you provide no exemptions for vaccine mandates, that's insane. And it appears to me that this administration is currently mixing bad policy with medicine, which the end result is a toxic outcome to our healthcare system as well as our economic well-being and who knows what other manifestations as well. So thank you for each of your expertise with this. I look at this and I hear my colleagues talking so many issues. We've got enormous hypocrisy coming from this administration, where months ago talking about that we're not going to allow any kind of vaccine mandate, and now all of a sudden we do. We have scientific problems with this whole thing that many of you have brought out, and just add to that the number of people who have already had vaccines we are pushing a point that the vaccines are not even needed because so many people in the country have already had them. Then you have the constitutional issues, which my colleague from North Carolina just brought up, where these are issues that ought to be left to the states. Then you have, which our office has been inundated with, the no respect for medical and religious exemptions. And I mean, this is absolute insanity that we are even here having a hearing such as this, given all the violations and hypocrisy and trampling of our Constitution and individual rights. And where does this take us as a nation? It is stripping us of our individual liberties. Now, I've got a couple of questions. Let me begin, Ms. Parker, with you. There's so many organizations that are out there filing a lawsuit against the Biden administration with this over the employer mandate. Where do you see this long-term going? Where is the long-term impact of the vaccine mandate, do you think?
Well, long term, obviously, we hope it gets blocked for small businesses. You know, the small businesses that I've talked to have said to me, you know, what is the science between 100 employees? Does the virus not go where there's 99? One of our plaintiffs is a trucking company in Minnesota, and as we all know, we have a massive shortage of truckers, even before COVID. He cannot afford to lose one trucker, not one. The logistics of trying to set up a tracking system. He's vaccinated himself. He believes in the vaccine. He's encouraged them and suggested it, but it's a personal choice, and he supports their choices.
Okay, well, let's go there just one step further. We already have vast labor shortages in this country. We are paying people to stay at home, so we've got a massive problem in the labor force already. And then you add to that the mandate, whereby individuals are going to be forced to have a livelihood or quit. What impact is this going to have on the labor force in the country?
Let me tell you the population in this group, because the SBA defines a small business as any company with under 500 employees. This mandate hits companies that have 100 or more. So there are 20 million employees in the population that is 100 to 500. So you're talking about 20 million employees being impacted by this. And if you look at about, anecdotally, we hear about 30% don't want to be vaccinated and may not want to submit to weekly testing. So that's a huge impact on the workforce, and also decreases the supply available, the pool of people available just to hire. So that's a huge impact on an already suffering workforce.
Okay, thank you. Mr. Crocker, I'd love to get some answers from you. I'm going to pass right now because I want to get to Dr. Rutherford, but about the supply chain, how this is going to impact the supply chain. Dr. Rutherford, you mentioned some 18,000 deaths related to the vaccine being downplayed. Suspected to be related to the vaccine. On the other hand, we have some 700,000 plus individuals who supposedly died from COVID, and we all know those numbers are grossly exaggerated. What's going on here? Why are we exaggerating on the one hand the number of deaths versus downplaying deaths by COVID and downplaying deaths by the vaccine?
I think it has to do with greed and power. That's the only explanation that I can come up with. I know there are some other theories. I try to stay away from something, the conspiracy theories. It really doesn't make sense. In 1976, they stopped that year's flu vaccine, the swine flu vaccine, after 25 deaths. And I think there were maybe 93, 95 cases of Guillain-Barré from that vaccine, and that was a big enough signal for them to stop giving that vaccine. So I don't really have a good answer for you, but it's not surprising just based on what we've seen from the government and the pharmaceutical companies and the collusion in the past, like I said, with the opioid epidemic.
Thank you very much. I yield.
Thank you. I recognize the gentlelady from Colorado, Ms. Bobert.
Thank you, Mr. Chairman, and thank you all for joining us today for this very important topic. You know, it's mentioned just how unconstitutional these mandates are, how frustrating it is for employers and employees, but also I have visited the southern border, and I have seen the complete invasion of nearly 2 million people coming into our country illegally this year, and there's no such mandate for the people who are coming across our border illegally. In fact, many of them are not even being tested, especially by Border Patrol agents. When I ask Border Patrol agents how many people are testing positive, they say, well, we don't have anybody testing positive because we're not testing them because we cannot afford to quarantine the amount of people who would test positive. So they're being shipped all throughout our country, and the American people are being punished for this seemingly Fauci-funded Chinese virus, and now we're facing these vaccine mandates. But there are 27 states, Republican and Democrat, that won an injunction from the Fifth Circuit Court of Appeals, like we've been discussing today, halting the Biden regime from enforcing its unconstitutional vaccine mandate. People are losing sight of just how extreme this OSHA emergency order is. In 50 years, OSHA has only issued 10 emergency temporary standard orders. 6 were challenged in court, and 1 was unconstitutional. Only 1. Previously, OSHA determined that health is an intensely personal matter, and government coercion should not be used for vaccines. This mandate goes against 50 years of precedent and OSHA's own determinations. The court found that Biden's mandate is fatally flawed and staggeringly overbroad. The court condemned the Biden regime for having health agencies, and I'm quoting, make housing policies and occupational safety administrations make health policy. By using the deep state to regulate every aspect of our lives, this administration is violating the constitutional structure that safeguards our collective liberty. Apparently, this warning meant nothing to this administration, as we've all seen, since they encouraged businesses to ignore the court order. This is tyrannical. We are living under a lawless administration who has no regard for the law, no respect for it, and certainly is not upholding it. And while Biden is encouraging you to ignore the courts, the House Freedom Caucus is saying just the opposite. Oppose the mandates. Take a stand for personal freedom, and as a business owner, I promise you your employees will remember and appreciate you taking a stand for their rights. I have many businesses in my district who are coming to me saying, we don't know if we're going to have a job. I have employers saying, we may lose our federal contracts, so we are going to have to enforce this. And so these are the conversations that we are having behind the scenes with people, telling them, don't force this on your people. But I want to thank you all for being here, but I do have a couple of questions for Dr. Rutherford. As somebody who has treated hundreds of COVID patients and who works in rural healthcare, can you explain how the vaccine mandate will impact the already strained healthcare system in rural America? Have you heard of the facilities being forced to triage care because they do not have enough workers?
I am hearing those stories, and I have some colleagues that I know who are most likely going to lose their jobs. As you know, most physicians are employed by hospital systems now. I'm fortunate because I own my practice, and I also don't bill Medicare or Medicaid, so I don't have to force my employees to take the vaccine. But we are going to see, I'm afraid, I hope I'm wrong, but I think we're going to see another surge of COVID in the winter. If we don't see COVID, we're going to see flu. And we have many nursing shortages. Some of the physicians are going to be retiring who are able to do so rather than get a vaccine that they don't need. So I think that's going to be a huge problem, especially in rural areas.
Thank you, Dr. Rutherford. And just to follow up, have you personally felt or have you heard of other doctors who have felt pressured to not prescribe any form of medicine since COVID? In other words, have you wanted to prescribe some form of medicine to your patients but were told not to or felt pressured to stay away from certain medications for fear of a reprisal?
Oh, absolutely. Many doctors. And most of it is coming from the pharmacies. The chain pharmacies are owned, they're huge. They're part of the whole medical complex. Some of us call it the cartel. And they do not want to fill the prescriptions. There have been threats to turn physicians into the medical boards if we prescribe these medicines. And like I said, it's ridiculous. I prescribed medicines off-label for many years, and so many of them are much more harmful than anything we give for COVID.
Thank you, Dr. Rutherford. My time has expired. Thank you all so much for being here and for getting this out to the American people. I appreciate your messages. Thank you.
Thank you. I now recognize the gentleman from Alabama, Mr. Moore.
First, let me say thanks. I appreciate you all being here to answer these questions. And just a background story, I have Fort Rucker in my district, and we launch more aircraft every day than the Atlanta airport. And a few weeks ago, we decided to set up a hearing on these mandates because it's a federal base. You've got a lot of government contractors and IPs, individual civilian contractors that work at Rucker. And so I was expecting about 30 or 40 people, and I pulled up at the place where we're having a meeting. Nearly 400 people, maybe 450 were there. And they're concerned about what do they do, and Jonathan, I'm going to kind of direct this at you, but I need to know what to tell my constituents because we're kind of coming down to a deadline. And I actually had a 58-year-old man call me the other night, and he said, Barry, he said, if it comes down to keeping my job or getting this vaccine, he said, I'm walking off my job at Fort Rucker. Well, the issue is those are people who are well-trained. They're skilled labor. They're aircraft, power plant, IPs, this sort of thing. And to me, it's a national security issue. Jonathan, what do I tell my constituents? What is the best plan going forward for them to protect their individual liberty? And some of these folks are vaccinated. It's not just about, many of them are vaccinated, but it's more about individual liberty and this president and his overreach with the administration. What do I do, Jonathan? What do I tell my people?
Congressman, thank you for the question. I think that is, I hate to say this, even as a litigator, because I do think the courts are the place of last resort, but I would encourage them very seriously to consider joining in one or more of the challenges that are ongoing in court to especially the federal contractor mandate, and there's growing numbers of challenges to the federal employee mandate as well.
So in a sense, you think we can buy time for these folks? Are they okay to say, hey, I'm not doing this until we get a ruling from the courts? And I know that's the wheels of justice turn slow sometimes, so that's a concern because we're running up on some pretty hard deadlines for these folks.
So I'll give just sort of a fresh from the headlines example. There is a judge in Fort Worth, Texas, who just signaled an openness to kind of continue considering giving some immediate or preliminary relief to some vaccine hesitant employees in the case that he's got. And I think that option is at least a promising one. Nothing certain in litigation, but that's a promising way to go.
Okay, thank you. And Sean, just quickly, I want to share a story. I have a friend of mine, or a young lady I know, that's a student at Auburn University, and they were requiring, she's a senior going into nursing, and they're requiring now those students to get vaccinated to go into the hospitals to do their residency, as they call it. And so she walked away from nursing, and I try to encourage, and I think it's important for us to remind those young students now that may be for this mandate is that in the future, those will be the people who didn't finish nursing and didn't go on to med school that maybe will be treating your generation. And so it's a concern going forward. And so, Dr. Rutherford, one last question. I want to pose this to you. And so, Dr. Rutherford, I've met with Lieutenant Colonel Long, Teresa Long at Fort Rucker. She is a flight surgeon. She's responsible for 4,000 air crews, and she's a medical doctor. And so they are now telling her she is not an expert and to sit down and shut up as she's starting to see problems with these air crews as they get these vaccinations. Actually, 3 pilots asked her to be grounded because they were unsafe to fly the aircraft, and her command structure is saying, no, you can't say that, and you need to send them out to do their job. How are we determining our experts in this situation, Dr. Rutherford?
it seems to be that people that are in very high bureaucratic positions are being called the experts, and they have been wrong numerous times. So I think, you know, I was declared an expert in a hearing here in Kentucky where a small business challenged our governor's mandates, and that person won, the plaintiff won, and I think occasionally when it gets to the courts will recognize the real experts, who are the doctors that are out here on the front lines dealing with COVID. It's unfortunate that that's happened to her. I actually saw her speak when she appeared in front of Congress, and it's egregious that any of this is happening. But I guess the media determines who the experts are.
I think you're right, Dr. Rutherford. I'm about to run out of time. I want to pose one quick question, but I think basically you're an expert if your version fits the narrative. It sounds like to me that's how we're determining now who our experts are going forward in this pandemic, as they call it. So with that, Mr. Chairman, I'll yield back.
I thank the gentleman, and I recognize the gentleman from South Carolina, Mr. Ralph Norman. They're bringing you a microphone now, Mr. Norman. Take a breath and then rev it up, brother. You only get 5 minutes.
Thank you. Thank you all for coming and for testifying. This has been a catastrophe all day long. I mean, all year long since this Biden administration took over. What are your thoughts on the Fifth Circuit, you know, putting a stay and him not, Biden not going by it? What are your thoughts that we should do that we're not doing? And Mr. Berry?
Thank you. So that's right. The Fifth Circuit stayed the mandate, and the Biden administration was reported to have, it seems essentially to be trying to scare businesses and workers into submission in advance of what I believe is going to be the Supreme Court stepping in, shutting this down. That seems to be continuing, and I think doing exactly what this caucus is doing by throwing a big spotlight on what the administration is doing and calling out this apparent disregard of what the court has said is extremely important.
What should we be doing to affect that? What would be the most effective role for us to play as we move forward? I mean, we can have press conferences on it all day long. Is anything else that's a concrete action that y'all feel we need to be doing?
I think that I think this House, even from a minority posture, exercising as much of its oversight authority as possible to really drill into what's going on at the agencies that are pushing these mandates, and relatedly having, I think, going to even to the administration with the stories of your constituents and how they are suffering. There's a huge role to play to get that material into even the administrative record as a legal matter is valuable.
I guess as a follow-up on that, a lot of companies are paying the fine, the ones that can afford it. Do you think retroactively, if the Supreme Court rules in our favor, making it unconstitutional, that can be replenished?
Oh goodness, there'd be some serious questions there. So that's that's something that companies need to think about carefully before going ahead and paying fines this early.
Okay, Mr. Chairman, I'll yield back. Yeah, I'll yield to
Mr. Berry. I wanted to sort of follow that up because one line in the Fifth Circuit's opinion, it says the mandate places an immediate and irreversible imprint on all covered employers in America, and quote, complying with a regulation later held invalid almost always produces the irreparable harm of non-recoverable compliance costs. So following on the question Mr. Norman has asked, but I was asking earlier, if indeed it turns out to be the case that the President of the United States has grossly overreached his power that the United States government does not have, and has, as a consequence, and the threat of that has impaired the economy, has imposed economic burdens on millions of businesses across this country, what remedy will those businesses ever have other than for that president to be impeached?
It's likely not going to be something that the courts can provide, to be honest. So it's going to be what this legislature chooses to do, Congressman.
Thank you, sir. I yield back to Mr. Norman.
Mr. Chairman, I yield the balance of my time. Thank you.
Thank you. Ralph, Mr. Norman, do you yield to Mr. Moore? He's craving 30 seconds. Mr. Moore, he's yielding to you.
So I asked the other three panelists, but Mr. Crocker and Ms. Parker, so if you got a business with 190 employees, have we looked at the cost of separating corporations where you have your buying arm and your manufacturing arm, so you stay under that 100 mandate for the meantime until the case settles? And then Barry, Jonathan, you may want to jump in.
So this is a drawing of a camel. And on top of the camel, there's a straw. Have any of you ever heard of the straw that broke the camel's back? I'd like to paint a picture for you of a stretcher laid out in the middle of this room. And small businesses across the country, including mine, one I've worked 32 years, I've worked my fingers to the bone, is on the gurney. I'm telling you, folks, I said earlier, some of you weren't in the room, this switch, 2-week lead time for the last 20 years. I've had them on order since June. I brought this piece all the way from Florida. Used to be 1 month, I had my purchasing, I said, just give me 3 parts. The third one was too big, I couldn't bring it. Used to be 1 month. It's now 6 to 7 months. Mr. Biggs, I have 2,200 parts here to build my most common truck. I can't get the parts. And we're in this room, instead of talking about how to solve the supply chain crisis in this country, I'm telling you, I feel that my business is on the line. And we all in this room, we agree about the insanity of this mask mandate. Well, it was the mask mandate, now it's but the straw that broke the camel's back, remember, it wasn't the 500-pound piece of concrete that broke the camel's back. It wasn't the biggest thing that broke the camel's back. And this little saying that has lived for centuries, perhaps it seems to represent some timeless advice that be careful what you put on businesses. Frankly, to your question, Mr. Moore, I can't afford one more distraction. Can you imagine what it would take me right now to set up another company and legally separate my payroll and buy another workers' comp policy for the other company and set up liability for the other company and try to get bonded in the other company? I can't get bonded. I have no history. I have no contractual history. It's impossible to try to get government contracts. There's no history in that other company. So now you got to try to bifurcate and try to, okay, which company is going to do the, and it's already just at this very fragile time. It's impossible. I can't do it. Even if I wanted to, I couldn't do it logistically. And besides that, I feel like I have to stand as an American. Why in the Boston Tea Party, I bet you somebody told them, hey, instead of, just don't do this silly thing, dump all the tea over, just create different routes. Let's just organize that ship and just take her down south we'll make another port down there and just avoid the taxing authorities. It's time to take a stand. And so I want to stand humbly, but I want to stand proudly, and I want to stand strong and just say we're not going to do it, and we can't do it. And I feel so badly for all the other businesses. For sure, there's so many businesses that have already tanked. And all that wasted energy and time and money and blood, sweat, and tears that these business people put in, and it's all wasted because it's just gone. We're killing our businesses.
Thank you very much. It's been very informative, and you've brought home some real-life issues that we're trying to convey to the American people. There's a whole smorgasbord of bad policies that are inflicting pain on businesses right now. Just a plethora of bad policy. And this one is perhaps the most widespread. It is in some respects, it seems like it's not a big deal because it's just a vaccine mandate. But in my opinion, it is the
final, you said straw, the final straw, the ultimate symbol of tyranny. So I have just a few questions. Mr. Tima, you know, the universities have long left the notion of free exercise of academic expression, and now this is just one more example of it. What do you think Congress ought to be doing right now to help protect academic integrity, which includes students being able to have choice over their medical decisions when they go to school?
Absolutely. Well, for one thing, keep doing what it is you're doing with fighting this OSHA mandate, fighting this from the top down. Because like I said, the Biden administration is the one setting the precedent, where all the other private colleges, the public colleges, the campus bureaucrats, they can then go say, well, it's not really our decision, it's coming from the top, we have to obey, it's, you know, we're just going with the times. No, we stop it right from the source, and we keep working our way down from there. So doing exactly what you're doing with NOSHA and fighting this mandate will have a trickle-down effect. When it comes also to academic freedom, right, standing up and recognizing these unconstitutional free speech zones and some of these anti-bias policies on campus as well will have a tremendous effect. And we got a great start with that a couple of years ago with President Trump. But there are still policies on campus right now where if a student has not jumped through every single hoop, they could be spending a night in jail for handing out the Constitution. You think that's egregious? You think that's ridiculous? It has happened several times before, and we've represented students on that front. So protecting free expression from these free speech zones, these codes, these anti-bias policies, as well as stopping this vaccine mandate right at the source and giving no bureaucrat the chance to impose it on people down below.
Thank you. Dr. Rutherford, I appreciate you appearing today by Zoom. And we've talked about VAERS a couple of times, and I guess my question with regard to VAERS is, do you think that the COVID-19 mortality rate for the vaccines is accurate, or is VAERS actually gathering reliable information? Do you trust the information from VAERS, I guess is the question.
That's a great question. In the past, VAERS has been thought to be subject to underreporting. And I can tell you that in my experience, most doctors are not taking the time to report what they think are vaccine side effects. It's very hard to prove causation from a vaccine, but all of these deaths seem to be happening within 48 hours of the vaccination. So that is concerning. What it, at a minimum, should have done was it should have alerted the people in government, the people in the FDA and the CDC to wake up and develop or form some sort of panel of independent physicians or scientists to track this better and to look into it further. And as far as I know, that's not happening.
Thank you. Mr. Berry, you were asked what we could do to help you further your cause, and I'm just wondering if we've responded with an amicus brief, if that would be helpful, or are you getting amicus briefs from anywhere outside?
Yes, I think that given especially the really profound separation of powers issues at stake in this case, where the executive is trying to take the OSH Act and treat it like a complete blank check. I think that an amicus brief from members of the Article 1 lawmaking body in our federal government would go a long way to highlight those issues to the courts. Absolutely.
Thank you. And then as we wrap up, I want to thank each of you, the witnesses, Ms. Parker, James, thank you for being here. Thank you, Mr. Berry, Mr. Tima, Dr. Rutherford. Thanks to each of you. What you've said has been meaningful. It's been very helpful and at times poignant. We're grateful to you for being here. And I will tell you, I know that you're going to continue to fight, and the members of the Freedom Caucus will continue to fight as well. And with that,
Can I say
You get 5 seconds.
Mr. Crockett, just to respond to what you, I'm in the real estate business. We've got houses sitting, people cannot get water heaters. You talking about parks? Got a call, I get calls from everywhere. People trying to hire people that they're going to let go to manufacture a solvent and a fuel. This is a deliberate overtaking of our country. This is intentional. There's no way you can make this many mistakes in 9 months. And he's putting the businesses out of. I can't tell you in my little town the people that are going broke. So it's time. I mean, politicians, we can do what we can, but it's time to activate the people. There's nothing off limits in my mind. This country is under attack.
Thanks, and I close with what Samuel Adams said. He said that we may not be the majority, but an irate minority that lights fires of freedom can win. And we can win this battle because there is an irate minority, and actually I think it's an irate majority, quite frankly. And I think as people stand up around the country and we continue to fight for freedom, we'll prevail. And so never lose your hope and just keep fighting. With that, we're adjourned.
Recording stopped.